I've recently completed my 3-year Bachelor of Midwifery. I'm currently working as a new graduate midwife. I have been for a few months now.
I'm a very proud Aboriginal woman. I'm a midwife. I'm a mother to 3 gorgeous children and a grandmother to 1 beautiful little boy.
I'm a midwife who's worked in a rural, remote area for the last 2 years. Our local hospital was a non-birthing unit, and the women had to travel at least 400 kilometres to have their baby.
Working so closely with a woman throughout her pregnancy and birth, answering questions, referring women on to other care, being a bridge between the midwife and the woman, all of these, being on call, all of these things sort of gave me glimpses into how it is to be a real midwife.
Historically, Aboriginal women view birth as a normal process. We don't feel that we need to rush in to see a doctor or a midwife as soon as we fall pregnant. We can feel our baby kicking, we've got our mums and our aunties to tell us everything's all right. But I think that by increasing our workforce, it will start changing statistics such as low birth weights.
The main difference between birthing in a rural, remote area and the urban area is the fact that the women have to leave their homes up to a month before the birth, and this incorporates so many problems for them. Where do they go? Which hospital do they choose to have their baby? How do they get there? Where do they stay when they get there? And there's that pressure once they get there that it's costing them to stay there. So then they have to think about, when am I going to have this baby? And so if they're offered an induction or they request an induction or caesarean, for them that's a good option.
Sometimes things happen that are beyond anyone's control, but even in those instances, women, trying your best to make sure that they feel in control and that they feel informed and that they know what's going on, and really, I always tried to do that, to spend that time. Often the midwife herself would be very busy, with that woman's care. So, something as a student we can do is just be with the woman, be with her and talk to her and reassure her, and if you can, be honest with her. And as a student, this was something I felt I could do more than the midwife, just be with the woman, and that was fantastic.
I would advise any midwife or midwifery student looking after Aboriginal women, that if you're not sure, just ask. It's really okay to ask. I think that's one of the things that is really important, that we do ask people if it's okay and if it's not okay.
And it was just beautiful to watch the social interaction around the birth of this baby and the support the young mother got. And then she had to leave, and it was months before she came back to town. And a lot of people, even her own mother, was trying to find a way to get to Sydney to be with her. Huge issues around that sort of thing. And I think that's one of the saddest things about it, is that it breaks up families rather than bringing them together, which in the city, that's how it seems, that all these families come together when a baby's born, whereas up there it tears them apart.